The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. This is Deanna Mitchell again with Leading Age Michigan, and welcome to our Safe and Calm webinar for March 10th. We're going to depart a little bit this morning from our standard agenda and start with an update from Dave. We'll be talking about our Give Seniors a Say campaign. He will be talking about our plans for annual conference, and he will be providing some information about a new certification program that we have developed. Then we're going to move on to our standard agenda with an advocacy update from Dalton, followed by a very brief Michigan situation update, and then on to resources and new guidance. This morning, we're going to be focusing on some of our favorite topics: visitation, testing, and vaccines. So with that, we'll now turn the presentation over to David Herbal, our President and CEO.
Thank you, Deanna, and good morning, everyone. So happy to be here today and to talk to you a little bit about our Give Seniors a Say campaign and some of our other advocacy efforts that have gone on. However, before I get into that, I just want to mention that this year, this being the anniversary of the pandemic, I wanted to thank you all for everything you've been doing on behalf of Michigan seniors, and certainly how hard your staff has worked deserves acknowledgement. However, I also want to just take a quick moment before I get started to thank Deanna, Dalton, Blake, and any of our business partners who've helped provide education over the last 12 months. This will mark close to our 90th webinar in the past year, and I can't tell you how hard our team works to not only synthesize the information, but stay current and try to address your questions as best I can. I'm very proud of our team, and I hope you realize that they've really put in a lot of effort to get this done. So again, to our business partners, Deanna, Dalton, and Blake, thank you very much for everything you've been doing over the last year. Moving on to our Give Seniors a Say campaign, I just wanted to talk to you a little bit about some of the advocacy that we've been focusing on over the last year. Those topics are kind of listed here. I really don't want to go into each of them individually, but just to really focus on the one that was the driving force behind Give Seniors a Say, and that is visitation. You know, Give Seniors a Say launched our statewide advocacy campaign to bring the voice of the senior and the families back into the policy discussions in Lansing. And this really came out of the leadership at Leading Age Michigan and our board members. There was a lot of concern from them on the behalf of what's happening to the seniors in our facilities and what the families are experiencing. And out of that discussion, Give Seniors a Say was born. And so we have to thank those folks. It really has been an interesting discussion in trying to pull together a statewide advocacy campaign that includes a lot of different and moving pieces. And so I wanted to just touch on some of those pieces that are also there listed on this website, on this slide, excuse me. So, you know, we've had some web design with Give Seniors a Say. We've also created some advocacy toolkits for you and your folks on your team to contact your legislator, and also done a number of interviews both on radio and TV in regard to not only visitation, but regional hubs and legal immunity and some of the other topics. But we've really been focused in on this visitation discussion over the last, I'd say, 6 months, is you know, when our letter writing campaign really began with the department. And so we're thrilled to continue to move Give Seniors a Say forward. We've also had great success on our webpage with the number of visitors to our webpage since the program began. And so I'd just like to mention a couple metrics that I think will, kind of give you the idea of the number of folks who are visiting our page. So in the past month, the average users per day is up over 75%, with 750 views on our Give Seniors a Say page alone. Since announcing the program, our webpage has 950 new users. And in the overall, since the beginning of the pandemic, our webpage utilization is up above 21,500 users and 105,000 page views. So we're getting a lot more traffic on our website as well, and we're also seeing a pretty even distribution between desktops, phone utilization, and tablets. But by and large, it's mainly folks accessing the website from their phone. So we've got a lot of good things going on with Give Seniors a Say, and a lot of good things to come. And so you're going to be learning about a few of those topics in the coming weeks, all culminating with May this year, which is Older Americans Month. We hope to have a program ready to announce to you very soon that's going to try to bring everyone together in an advocacy push for the month of May. So with that, I'd just say, Blake, you can please advance the slide to the next slide. Thank you. Last week, the governor and Director Hertel made some, very direct movement that we think helped visitation in Michigan. We feel very positive about, certainly advancing that discussion. However, the one thing that is still hanging out there that is a continued advocacy point for us and has been from the beginning, which was, in May 2020, it's that Michigan is not following the CMS guidance as it relates to skilled nursing facilities. And we're very concerned that there are still restrictions on Michigan providers that, and quite honestly, our seniors, that we think are a bit of an overreach by the folks at the Department of Health and Human Services. The four general topics that we really are concerned about related to visitation is that we think it should be allowed to anyone in observation for symptoms of COVID or persons under quarantine for 14 days when they're newly admitted or readmitted. We certainly believe that persons of faith at the end of life deserve visitation to fulfill their religious, transitional, and mourning rituals. And then general visitation for our residents and families really shouldn't be subjected to the 6-foot social distancing requirement. And we think that that's even got more credibility now that the CDC has recently published their guidance talking about visitation when both parties have been vaccinated. So, we're really hopeful that the department is going to follow not only CMS, but the CDC guidance. And then finally, the testing protocols. Michigan's testing protocols are much more restrictive than the CMS guidance. And we clearly realize that, that puts an additional burden on already overburdened staff in terms of time and additional functions. We're concerned about the supply chain pipeline as more and more people start looking for these point of care tests, as well as the idea that we could switch to once a month versus once a week testing. So we're very concerned about all of this, and we continue to advocate for that, not only in TV, but also in op-ed pieces and press releases that are going out to the department. So we've got a very public advocacy campaign as well as a private advocacy campaign with the director and the governor's office directly. So we look forward to more good news there as things move forward. Thanks, Blake. Move it forward. You're good. Thank you. This is a huge announcement for us, and I certainly want to call your attention to this. Please mark your calendars. We put together a little forethought, I'd say maybe a month ago, when we were thinking about our annual conference. And the general thinking that we had as a team was that, at what time of the year do you think the members would be ready to be back face to face, kind of reunited in an annual conference? And so we didn't think May was really going to cut it this year. So we started talking to the Amway Hotel in Grand Rapids about something in the fall. And lo and behold, luckily enough, our dates aligned with our prize. And so we're going to have our annual conference in downtown Grand Rapids during Art Prize. And so we'll have our traditional Solutions Expo as well as our awards gala acknowledging not only last year's award winners, but this year's award winners so that everyone can enjoy and celebrate last year's winners and new winners. Just a couple points of interest about the upcoming annual conference in September is that, the call for presentations is still open. So if you have an idea that you'd like to present on, or maybe something you feel you've done really unique in your organization, please feel free to submit that presentation for consideration. We have sent out a link to everyone earlier. If you don't have that link to submit your proposal, please let Anissa know, and she'll be happy to resend that link to you in the future. And that's how those presentations come in. And then also this year, we're looking for more volunteers. We want to try to get more members involved in the planning of the annual conference. And so, we have an awards committee that we're looking for additional participants on. Those are the folks who actually review the proposals for award winners. They evaluate those and then determine, which candidates should move forward for the final award. But then we're also going to revitalize our conference planning committee that we have had in years past, and I think stepped away from for various reasons. But we're going to dust off that protocol and bring back together the conference planning committee. And so what that committee does is we're looking for volunteers from the Grand Rapids area, but also from across the state for folks who'd like to not only review the education, but talk about the activities and just kind of help organize the behind the scenes flow of how the conference will run. So we're hopeful folks are ready to do that as well. So if you'd like to participate in that, we're asking that you email Anissa at leadingagemi.org and get involved in one of those committees. I'd just like to also acknowledge Anissa here for negotiating a great contract with the Amway Grand in Grand Rapids. If you can imagine that we have a room rate during Art Prize of $169 at the Amway Grand, that's pretty exceptional. And I just want to say thank you to Anissa for bringing her skill set to the association. She's done a great job in getting that done. And we hope to have registration open in July for the conference. And so we look forward to your participation there as well. And then lastly, just wanted to cover this topic for our Solutions Expo, for our business partners and anyone else who wants to participate in the Solutions Expo. Your point of contact is still Blake at leadingagemi.org. He does a great job in getting that structure pulled together and making sure everything flows well. So for our business partners who are interested, please feel free to reach out to Blake. And then finally today, I just wanted to announce to everyone, we've talked about this program once before at the business meeting of our annual conference, but again, just to let you know that in July 2021, Leading Age Michigan is going to be announcing an online residential care and assisted living certification program that professionals can get involved in for further professional development, and they can obtain their certificate through Leading Age Michigan. We've done a lot of legwork in putting this program together so that it complies with all of the NAB requirements for this program, and individuals will complete totally online 94-hour course, which will allow them to sit for the certification program from NAB. So we're really excited about that. And if you are interested in wanting to enroll in that program or learn more, please send us an email to information@leadingagemi.org. We're really excited about this. Interestingly enough, we have a sister state already wanting to kind of partner with us on this innovative program. So we're very, very excited to announce this. And I think one of the really interesting parts about this program is we're going to try to set up kind of an online and virtual mentoring program through the course studies of subject matter experts with each individual or a group of individuals, so that if anyone has questions as they're moving through the process, they'll certainly have some FaceTime or conversations online about how to get through the programs and really understand the content if there's any questions that folks don't readily can't obtain from the webinars. So we're excited about this new online training feature, and just want to make sure everyone's aware of it, so that if you're thinking about signing up for a assisted living certification program, remember Leading Age Michigan's program here, and that it's going to be up and ready for you in July of 2021. So thank you for that. And Blake, I think that concludes my presentation, and you can move on to the next speaker.
All right, thank you very much for that, Dave. Just a couple things before we did switch over. If anybody does have any questions related to anything that Dave just spoke about in the past few slides, we will go over those after Dalton's portion that is upcoming. And additionally, I did just want to add, I'm going to show my screen here really quick, or show this web page. I know that Dave had mentioned the call for presentations and getting a link for that. So we also have a link for that on our website. I just wanted to show you that. So if you go to our website, obviously, and then go to the education tab, there is the call for presentations. If you go ahead and click on that, that will take you directly to our survey, and you can fill it out there. So with that, I believe that we can turn it over to Dalton. Thank you very much.
Hello, everyone, and good morning. Welcome to today's Safe and Calm call. Today, we're going to be just running over a couple of things with some updates about some budget bills, one state and one federal. If you saw my announcement on the listserv yesterday, you'll know that the budget supplemental was signed yesterday. And then we'll also be going over some of the things inside I believe it's the American Rescue Plan is the title of it at the federal level. And I also would like to go over the direct care worker wage pass-through that was extended in the supplemental. So on the slide, you can see that the first talking point is that it was signed, and we've already covered that. It does extend the direct care worker wage pass-through program, and the governor did veto some parts of the supplemental relating to education. There was some kind of political ramifications for her to sign them, so she decided not to do that. But the wage pass-through program has been extended and fully funded until September 30th. So now, as a state, we have roughly $2 billion left in the federal funding pot for the governor and the legislature to allocate. So going forward, we do expect another budget supplemental and them to be talking about $2 billion in additional relief for the state. So we're going to run over the direct care worker wage pass-through in some detail. Some of this is going to be review because while the program, the actual structure of the program hasn't changed, some details have. So for instance, the direct care worker wage pass-through used to be $2 an hour. but that has now been increased to $2.25 an hour for rates set as of March 1st. These funds include all costs incurred to the employer, including payroll taxes, and the funding applies retroactively to March 1st. So it's as if the program has never lapsed for providers. And as I already said, the new expiration date for the program is September 30th. Those who are eligible for these payments have been expanded in this supplemental. So now not only can employees employed in SNFs, triples, and triple A's or state employees be reimbursed, but those in licensed HFAs and licensed AFC settings who meet the eligibility criteria will need to be given this $2.25 pay raise or pay increase for this time period. Who are eligible workers? These people include registered nurses, licensed practical nurses, competency evaluated nursing assistants, respiratory therapists, and direct support employees and job coaches who work in supported employment arrangements. If you were on the last webinar, you'll note that we were trying to seek some definition around what they meant by direct support employee. We did hear back from them a couple of days ago, and they let us know that they were really meaning they're trying to cover everyone who works in supported employment arrangements, which are essentially workers who help the disabled through certain kinds of contracts. I believe a member on the call last week helped us define that. And then eligible workers within a AAA are a little different. These are workers who work in home and respite care services. So just some specific language that goes along with these funds. Once again, some of this is going to be review for those who are intimately familiar with the program. Once again, these funds include all costs incurred by the employer, including payroll taxes. Any pay enhancement above the hourly rate that was set on March 1st, 2020 does not count towards the average compensation provided by any contract. Employees have a right to refuse the pay raise. The reporting requirements and process remain at MDHHS discretion. Last week, we did have some questions about how is this program still going to be rolled out? And we said that we didn't have a lot of information regarding how these new license types were going to need to report. And the governor also echoed our statements yesterday in her signing letter, as she did not let her department start implementing any of the programs in this legislation until yesterday. So they're going to kind of be scrambling to put something together here in terms of how should people report. So there's still a lot of unknowns at this time, but if you are currently in a SNF or you're reporting for a SNF, you follow the same process. And then additionally, child care workers were also added into this direct care worker wage increase, but they're set at a $2 an hour increase. So if you do have some child care that your organization participates in, you may want to look into this or reach out to us if you have any other questions. So that kind of wraps up our discussion around the direct care worker wage pass-through. We're moving on to the American Rescue Plan, which is a $1.9 trillion new COVID-19 relief package that had passed the Senate on March 6th. Experts believe it's going to be passed today by the House, and the president will sign it fairly quickly. So you can expect some kind of announcement in the next couple of days. I'm sure we've all heard of it if you really enjoy listening to news programs. You may have heard that the House passed a previous COVID relief package. It is not that package. It is the one that the Senate passed, so then the House needs to act today. So that's kind of that bit. And upcoming, we'll be going over some of the highlights as to what the funds will go to, what's included in that package. So what is included? So the big kind of chunk of this program is direct payments to individuals earning up to $75,000 and couples earning up to $150,000. They will receive the full direct payment or check of $1,400 per person. $1,400 payments for each dependent claim on their tax returns will also be sent on top of this $1,400 per person. Unemployment benefits have been extended. They will remain at the $300 per week, and this will go until September 6th of this year. A little piece within that, the first $10,200 in these unemployment payments will be non-taxable for households with incomes under $150,000. It is approaching tax season and is tax season right now, and you may have heard of some people not being able to afford the taxes on their unemployment. So they kind of tried to address that here. There's also $8.5 billion for the Provider Relief Fund, but this is for providers in rural areas, and HHS will distribute these dollars as they have throughout the pandemic. So we'll wait for further guidance on that when it comes to this new $8.5 billion rural support payment. There is $7.25 billion in new money for the Paycheck Protection Program. There's also some more allowances for not-for-profits to apply. Those include advocacy groups and larger not-for-profits. So if you haven't had a chance to apply or didn't meet the criteria, I would recommend looking at the new criteria to see if you can meet that. There is some monies for COVID-19 supports, $7.5 billion for tracking, administering, and distributing vaccine, $46 billion towards diagnosing and contact tracing for COVID, $2 billion for buying and distributing PPE and testing supplies. There's also an increase to the FMAP for home and community-based services. They bumped the FMAP, which is the federal portion that they match for Medicaid, from 7.35% to 10%. And this applies to state home health, personal care, pay services, and waiver services. Next, there's $25 billion for emergency rental assistance, and specifically $5 billion for emergency housing vouchers for people experiencing homelessness, survivors of domestic violence, and victims of human trafficking. There's $350 billion for state and local governments, and $25 billion to create a new program for bar and restaurant support. And grants would be up to $10 million per entity and $5 million per physical location, with a maximum of 20 locations. Before we move to questions, I did want to add, I didn't put a slide here. Yesterday was the hearing for implicit bias training at the state for healthcare providers. I will add that at this point, usually these hearings mean they're kind of just a check mark in essence. It usually means it's going to move forward. So just be on the lookout for that in the near future being added to the requirements for licensure.
All right, thank you very much for that, Dalton. So we do have a few questions here. We do just have one for you, Dave, so I will ask you that really quick. I'm not sure if we will actually know the answer of it yet, but worth a shot. In relation to the gala, when will award submissions be on the website?
Yeah, we don't have a date set on that yet, Blake, but I'm sure that will happen in the coming months. My guess is I'd start looking for that around June or July.
All right, thank you very much, Dave. It looks like that was the only question for you, so I want to turn it back over to Dalton. We do have a few questions for you, so I'll start running through them. How are direct care workers included in HFA, AFC? AL does not typically employ nurses or CNAs. They use resident assistants or a version of this.
You would have to meet those license types. So if those workers don't meet those requirements, they would not be included.
Okay. Where is the literature on the direct care worker wage increase located? I can't seem to find this anywhere.
So Once again, the department was asked not to work on these programs, so they haven't posted anything. I can get your email after and send you the bill language of the signed bill. That's all we have for right now. But I do expect the department to be coming out with a letter, an L letter shortly, since they have for every other time the direct care worker program has been extended.
So only certified nursing assistants are eligible for the 225, so no non-certified direct support staff, nor dietary activities, housekeeping, maintenance, or admin staff quality for the 225 wage pass-through.
That was a long list, but I'm going to say yes.
Yeah. Okay. Dalton, any update on the QMI? We are now 5+ months behind.
Yeah, so we have talked to the department and they said they were going to be rolling it out in the next couple of weeks. I want to say about a week ago is when they're going to be rolling out that program again. They said that most of the providers who had not provided information during the pandemic when they first kind of shut it down 5 months ago, that they'll be rolling it out. We can follow up with them again to see what they said, because they did say that they'd be trying to roll it out soon again. So we'll provide another update shortly.
Okay, and then I'm not sure if this one is also repetitive, but does this include the workers who provide the direct care and AFCs? Where do they fall on the eligible list?
Well, it would depend on if they meet those criteria, those eligibility criteria. If they do not, then they would not be included in the program.
All right, sounds good. As of right now, it looks like that was the last question for you, so we can go ahead and move forward.
Okay, thank you, Dave, Dalton, and Blake. We're going to move on to a short update in terms of our numbers. With vaccinations increasing across the state and county, we have seen a major decline in caseloads following the record highs that we saw in late December. The outlook has been pretty good for Michigan as we look at the data. But we do need to note that since early February, when we started to first track this particular CDC map, Michigan caseload per 100,000 persons per week has increased and jumped up 2 whole categories. So while we still have relatively low numbers compared to December, we need to watch these trends as rates, and this is mostly obviously community rates, have been moving upwards slowly over the past 2 weeks. Another key issue in looking at the trends is that we are one of the states with the highest numbers of B117 variants. And this week we also had our first case of B1351 variant, which is the South African variant. Michigan is able to do the genome testing that identifies the variant itself. So it's possible that our variant numbers are higher because we do more testing here. But we also need to consider the fact that routine COVID testing does not identify these variants. The state has to pull a sample of tests to do some particular review to look for these variants. So the number of persons who are actually infected with one of these variant viruses may be much higher than these numbers show. So it's believed that the case in question, the South African variant case, was transmitted through the community. And what that means is that it wasn't simply transported by this one single person across a border. The new variant case was found in Jackson. The variant currently exists in 20 other states. And it's believed to be more contagious than the original virus. But there's no indication at this point that it carries seriously worse outcomes. Everyone's still monitoring to ensure that the current vaccines still work against it, and it seems like at this point that they do. Here's our routine graph of the Michigan 7-day rolling average of new cases, daily new cases, updated as of Monday. And you can see, as we talked about a few moments ago, the slowly increasing numbers. However, numbers do go up and down a bit all the time, so hopefully this will start trending downward again. At the same time, however, the number of deaths do continue to trend downward. And we believe this could possibly be due to the vaccination rate among older persons and nursing home residents, because they're definitely the core population at risk for both hospitalization and higher levels of death. So although we have more cases, it looks as if the death rate may continue to decline, which is of course a very good thing. When we look at the CMS positivity rates, we remember that last week we had no counties in the over 10% category, and that's the red category. 2 counties did move back into red this past week. And it's important to remember that although the state has relaxed its visitation guidance a bit, that CMS still has requirements for both testing and visitation based on these 3 categories. And if your county is at the red level, you will need to increase your testing and restrict most visitation. Excuse me. When we look at the caseload in long-term care facilities, we continue to see very good trends. Although the number of Michigan SNF cases increased overall, just a bit this last week, the numbers are still quite low. Seems to be stabilized, but if you look at this graph, you can see the amazing positive impact of the vaccinations. And again, all these updates are from the MDHHS weekly reports from Monday. And you can see that for homes for the aged, the overall number of new cases continued to decline as well to very low levels. And moving to the last slide, the case is pretty much true for adult foster care homes as well. So we're seeing really, really good trends downward in terms of caseload. So over the past week, we've had only 46 new resident cases in all these facility types that have to report. And new resident deaths have declined as well. Clearly, this is the positive result of vaccination. As we watch staff cases, though, you can see that there's still a significant amount of transmission there. And hopefully that will decline eventually as more persons agree to get vaccinated. So overall, now we have over 45,000 cases cumulatively in long-term care facilities in Michigan, and over 5,600 total deaths, and we hope those numbers do not go much higher. So we'll now move on to our general updates, and we're going to start with recent CDC guidance. So this week, the CDC issued new guidance for persons who are fully vaccinated. It is very important to note that this part of the guidance that we're going to review first is only for household, residential home-based activities. So they only apply for things that you're doing in your own private home. The definition of fully vaccinated, according to the CDC, means that there has been at least a 2-week period beyond the second dose if you received a 2-dose vaccine, or 2 weeks beyond the single dose if you're using the Johnson & Johnson vaccine. Persons who meet that criteria can visit with other fully vaccinated persons indoors without masks or distancing. They can also visit with unvaccinated persons from a single household as long as there's no one there at high risk for severe illness. And these fully vaccinated persons do not have to be quarantined or tested following a known exposure. So this second slide also has criteria that only apply to private residential home settings as well. Masks and distancing are still required when visiting unvaccinated persons who may be at high risk or if you're visiting with an unvaccinated person who is living with someone at high risk. And the reason for this is that they're still unsure whether or not the virus can be transmitted by persons who may be vaccinated. These persons must mask and distance when visiting unvaccinated persons, even if none of them are at risk, if they come from multiple households. And even though vaccinated, these persons need to be tested immediately if any symptoms arise. The CDC states that there's still potential for transmitting the virus even if you are vaccinated, and anyone who is vaccinated but testing positive still must be quarantined for 10 days. Or if they have symptoms, even if the people they want to visit with have been vaccinated, they have to be quarantined. So this only applies to persons who are fully vaccinated, test negative, and have no symptoms. So this next part of the new guidance applies to fully vaccinated persons when outside their homes, but it still does not apply to any healthcare or long-term care settings. So this new guidance, while it's very refreshing, it does not apply to nursing home or any other long-term care facility providers. As we stated earlier, any fully vaccinated person must isolate and be tested if they develop symptoms. Fully vaccinated persons who are in congregate settings that are not healthcare related. And the CDC included group homes in that definition. They have to quarantine anyway for 14 days. They have to be tested if they've been exposed to someone either with suspected or positive COVID. So the quarantine, even in non-healthcare related congregate facilities, is still required. And employees, and remember, this is not in healthcare settings, employees in non-healthcare related settings without symptoms do not have to quarantine after any known exposures, although testing is recommended. This week, the CDC also updated some of its guidance on variants. And apparently, the currently known variants all share a common mutation. And this mutation apparently gives the virus the ability to spread even more quickly. So this virus, you know, like all mutations, it's adjusting, and so that it can continue to survive. These variants can be problematic because as all viruses will mutate over time, they become more effective at causing illness. They can spread more easily. Sometimes they can cause more severe illness, although that's not necessarily the case. And as time moves on, our current tests could possibly no longer be able to detect them. And eventually they could become more resistant to therapies or current vaccines. So that's why it is really important to continue the decrease in spread that we're seeing right now. So this week, the CDC put out some informational pieces about the newest vaccine, and it has been found to be a bit more than 66% effective in trials at preventing illness completely. Now, it's true that those numbers are lower than the Moderna and the Pfizer vaccines, and there's been a lot of talk about that. But this vaccine is 100% effective at avoiding severe illness and hospitalization during these trials. So it's still considered to be a very effective agent to ward off the worst outcomes of the virus. The highest amount of protection against the virus was found to be at about 2 weeks post-vaccination. And there's some indication that this vaccine might provide some protection against asymptomatic infection as well, although I'm not sure that I personally understand how they would have measured that. It's important to note that this vaccine was studied in older persons as well as younger persons, and there are the same kind of side effects with this vaccine as with the others, but those side effects occur mostly in the under 60 age group. So the Johnson & Johnson vaccine is a bit different than the other two vaccines. It is rather than an mRNA vaccine, it is called a viral vector vaccine. So the other two vaccines use a laboratory-made genetic molecule that mimics the spikes in the coronavirus. And they put that in an mRNA genetic code designed to trigger the body to start an immune response against corona-type viruses. The Johnson & Johnson vaccine does something kind of similar, but they use a common harmless virus, an adenovirus, that will not cause the body any harm in and of itself. And it's the transportation agent for a piece of DNA, for a gene that creates that same kind of spike protein. And again, the body will start to create that immune response. The DNA strand, because it is much more stable than the mRNA used in the first two vaccines, it doesn't need the ultra cold storage requirements that the first two vaccines did. So we anticipate that with this vaccine, a lot of our facilities can start vaccinating themselves without requiring a pharmacy to do it for them. And we anticipate that coming down the road now. The link for the CDC information on the Johnson & Johnson vaccine is at the bottom of the slide. So we'll take a few moments now and pause for questions.
All right, before we get into any questions, I believe that Dalton has another update.
Yeah, just a quick update on the QMI and the direct care worker payment thing. We'll start with the QMI update. The department was waiting on a couple of exceptions to either be approved or disapproved, and they have since solved those issues. So they're ready to go with the QMI. We weren't able to get a date out of them, but just know that that is coming shortly. With the direct care worker thing, after hearing all the questions regarding kind of how the eligibility criteria doesn't apply to HFA and SNFs, the bill itself does leave some leeway for the department to make some determinations around who meets those criteria specifically in other settings outside of SNFs. So we'll be advocating with them to see if they can make some changes, and I'm sure that the legislators maybe don't understand the exact on-the-ground details of who works in each setting. So we'll work with the department to see if we can get those definitions to actually apply to people in HFAs and AFCs. And once again, those are licensed. I did receive that question the other day. These payments only apply to licensed HFAs and licensed AFCs. Thank you.
Okay, thank you very much for that, Dalton. Now we do just have one question, it looks like. Does the CDC guidance trump the MDHHS guidance, which states we must wear mass distance when gathering?
Can you repeat that, Blake, please?
Does the CDC guidance trump the MDHHS guidance, which states we must wear masks and social distance when gathering?
I'm assuming that you're talking outside of the healthcare setting. I think that we're really only talking about private homes in terms of not masking. I don't actually remember what the requirements are for the state in that respect, so I'd have to check that. But I think that the CDC guidance is something that you could follow, especially in your private home. I can look into it in more detail.
All right, thank you. It looks like that was the last question, so we can move forward.
Okay. So last week, the state issued new rules for COVID-related testing in nursing homes, HFAs, and the larger AFCs. It restates and continues most of the current testing requirements, as you can see the list here. It continues to use the county level risk codes, the county risk level codes, to determine the amount of testing that must be done. So you have to remember that although the visitation is no longer dependent on those low A through E codes, weekly testing is. They did add to this list the need to do testing for any visitors over age 13 prior to entry. That does not mean that persons under age 13 are not allowed to visit. They are. It is simply that they don't have to be tested. And asymptomatic persons who are recovering and within 3 months of onset or 3 months of the onset or the diagnosis, however they're measuring it, they do not have to be tested whether they're visitors or not. And it's important to remember, as we stated earlier, that facilities must comply with both MDHHS and CMS requirements, meaning that CMS county positivity rate must still be reviewed to determine testing and visitation levels. So if you're in the red category, visitation under CMS is limited to compassionate care, and testing of staff must occur twice weekly at that level. Thank goodness we only have 2 counties at that level right now. And obviously the state plans to continue to ship antigen test supplies, but they're only going to reimburse now for PCR tests that are confirmatory. And we know that that's going to be a change, a major change for a few of our providers. So the state acknowledges that it's been distributing 3 kinds of tests, Binax Now, CareStart, and the BD Veritor test. And they continue to state that anyone who has been properly trained can conduct the test. That's a question that we often still get. And they can be ordered by several kinds of health professionals. And, you know, it's obviously any nurse, physician, or physician assistant can order the test. And for facilities who are not mostly healthcare facilities, who do not have a health professional on staff, there is a state of Michigan standing order for FDA-approved COVID tests. And the link for that order and the instructions to use it is at the bottom of the slide. The guidance talks about self-collection, conducting the sample collection. It's actually a preferred method because persons who can self-administer the test do not require a person to come within 6 feet of them, and therefore there's less use of PPE with each new testing session. But if you are actually collecting the specimen, full PPE, including an N95 mask, must be used. Persons who are simply handling the specimens but are not collecting can use standard precautions. They do have to mask. They do have to apply standard precautions, but full PPE are not required. The department reminds everyone that tests and samples are considered medical waste and they need to be discarded as such. And the MDHHS website does carry training modules for each kind of test. The state guidance still includes information on when to do confirmatory testing. And of course, you must isolate anyone immediately with symptoms. If persons have symptoms and the point of care test is positive, that is considered a positive case, obviously, and no further testing is required. If a symptomatic person has a negative result, you should confirm that with a PCR test. And if a person has a known exposure, they're still required to complete a 14-day quarantine. For asymptomatic persons without exposure, and that's on the right side of the screen, positive tests should be confirmed with a PCR test. And if that PCR test is negative, they of course would be considered negative. So this graphic is a bit confusing to me, and I guess I'm not sure why the state puts these graphics together when the CDC has similar graphics anyway. This one is included in the state guidance as well, but these next 3 slides and graphics are specific to long-term care settings. So it says for symptomatic persons who test positive that you should isolate pending confirmatory testing, but there's really no need to do confirmatory testing if you have symptoms and a positive point of care test. So this could be an error, we're not sure. If symptomatic and the point of care test is negative, you must continue to isolate, of course, until you get confirmation through a PCR test. If positive, continue to isolate, and if negative, they want you to continue to isolate until 24 hours after symptoms reside. I don't think I've seen that guidance before. This seems to be a precaution that I'm not aware of that's in the CDC guidance. For asymptomatic persons who've had close contact in a long-term care facility, you should obviously quarantine and test based on the close contact. And if that first test is positive, you should confirm with a PCR test because the person is asymptomatic. And of course, if positive, then you should treat as such. If the PCR test is negative, you can discontinue isolation, but then they state that the quarantine may still apply. And I'm not sure what that really means, since the results pretty much the same between isolation and quarantine. And it doesn't say what the conditions might be where quarantine may still apply. So that's a little confusing as well. So it pretty much seems that no matter what the testing shows in this scenario, persons in close contact pretty much need to be in quarantine. We think that this is pretty much designed to identify the outbreak situation. So if you have had outbreaks, this is how you need to look at those persons who may have been exposed. And because they're exposed, a simple test that says they're not currently COVID positive does not mean that they will not become so. So that's why this is a little bit different, I think, than the other scenarios. And the last scenario is pretty much the easy one. It is for persons who are asymptomatic and without any exposures. These pretty much would be persons who you're testing weekly, such as staff. Obviously, if it's positive, you confirm with a PCR and treat accordingly. And negative, of course, should be considered negative. Reporting on the PCOC tests can be completed using the form at the bottom of the slide. That's the MDHHS form. And if you're doing point of care testing, that form is enough to inform the local health department as well. So they've updated their reimbursement requirements as well. They will still reimburse for specimen collection, but they're only going to provide funds for PCR tests that are confirmatory. They have put a limit of up to $100 per PCR confirmatory test, and they will only pay for those tests for private pay, Medicare A-stay residents, and staff. Because labs should be billing for any Medicaid or Medicare Advantage plan residents on their own. Another thing to remember is that facilities can use the state lab for confirmatory PCR tests at no cost, although I think that the turnaround time is not necessarily great there. And the path to reimbursement through the state has not changed. Nursing homes have a different access point than HFAs and AFCs. None of that has changed, but it continues to be in the guidance. And remember, of course, you don't want to send any personal identification in with your reimbursement requests. So with the recent changes in both the testing and the visitation guidance, the state has now put the FAQs for both visitation and testing together. So we're going to review some of the provisions that are in that document that seem to keep coming up in terms of questions and or discussion. First thing to remember is that any person coming into your facility who is providing a service either to the facility or to a resident, is considered a medical or non-medical service provider. They are not considered a visitor, and they need to be tested in the same manner as if they were staff. You do still need to have someone trained in infection control on site whenever there is visitation, but they do not have to monitor individual visitation. You are allowed to designate visitation times and days, and this guidance for visitation includes all long-term residential facilities, including unlicensed assisted living and smaller AFC homes. It's only the testing guidance that does not apply to those types of facilities. So the visitation guidance applies to all of the long-term care residential facilities. For those that are covered under the testing guidance, those providers are expected to provide point-of-care testing free of charge to visitors. And you can accept any negative findings from tests done within 72 hours of the visit. So you don't have to test your own person more than every 72 hours either. The guidance also says you can choose to test more frequently if you want to. And of course, if the person is 90 days post-COVID, you don't have to test, but you do need to have documentation that confirms that. The department strongly suggests that tests ideally should be done out of doors, but of course the weather may not agree with that. And if it doesn't work out of doors, at least in a well-ventilated space that is far from the resident area. The state also identifies that facilities must support and accommodate visitation, including compassionate care visits, when they can meet all of the safety requirements that are listed in that visitation guidance. And those are the same requirements that have been there since it was first put out in October. If you deny visitation, you must provide notices, written notices with rationale for persons who want to do ADL visits or end-of-life visits. And that, of course, is not new. And although there's still conflicting messages coming out of different departments of the state, the MDHHS team last week confirmed that they have not changed the guidance for visits to persons who are COVID positive, and they've not changed the guidance for persons in 14-day quarantine as new admissions. They did say that they would be reviewing it again, but we have not seen anything in writing. It's also important to remember here that hopefully the state will continue to work toward aligning better with CMS. But CMS is also reviewing its visitation guidance, and we might see more flexibilities from them in the near future as they consider the lower risk, really, to our residents, considering the number of persons in these facilities who've been vaccinated. So we certainly hope that some changes will be coming from both the state and the feds, and we hope for more consistency and alignment between those two sets of guidance. So another reminder that visitor testing is not required for small AFCs, unlicensed assisted living, hospices who are not licensed as nursing homes, etc. The state still requests 2 weeks notice for supplies. The form to request those supplies is noted here. And if you want to send the confirmatory test to the state lab, the instructions to do that are included in the link here as well. I actually added this slide just a few moments before we started. We got this announcement from the state just a few minutes before the webinar. And pretty much it refers to the fact that the CDC has updated their NHSN reporting modules again. And that's going to impact the required weekly reporting to EM Resource effective today, March 10. Nothing like the last minute, is there? EM Resource has been updated to meet the latest federal reporting requirements. However, it necessitated the development of additional boards in EM Resource. So it's important that you complete all the required elements as described in the attached quick guide, and we will send that quick guide out with our materials for today to ensure successful data transfer to NHSN. The department is currently looking at the need to issue a provider level letter that will address all of these updates and reporting policy. So apparently these changes are new and effective today, and we will be sending out the quick guide that the state just issued momentarily. And last, the state yesterday extended the dates for recertifications using the nursing home level of care determination, and they've extended for another 180 days. There are some exceptions for LOCD Door 8 for persons who were approved based on their frailty criteria. Those persons must have another LOCD completed if they need to recertify. They also talk about discharge planning in this notice. And that local situations regarding the pandemic and an individual's vaccination status should impact discharge planning for them. So we recommend that all our nursing home members review this guidance, and the link is on the page. So we can take some questions.
All right, thank you very much, Deanna. We have a decent amount, so I'm just going to hop right into them here. MDHHS says any staff who tests positive and hasn't worked in 48 hours would not count towards putting residents back in the rotation of testing until 14 days without a positive. Can the same be applied to visitors? Would the positive person who has not worked in over 48 hours also not be counted for us having to stop visitors?
Say the second part of that again. Would that also count for?
Would the positive person who has not worked in over 48 hours also not be counted for us having to stop visitors?
I'm not sure I understand the nuance of the question. It's true that you don't have an outbreak when you have a staff person who has not had any contact with your facility for 48 hours before symptom onset or the actual positive test. I'm not sure how that would relate to a visitor. I guess let me review that question in writing, and I will try to respond to it more adequately.
Okay. I heard on a Region 6 call yesterday that the state would not just be sending the testing to nursing homes anymore, but that we had to order the testing. Do you know if this is correct?
Yes, my understanding is that you have to order the testing, and the information and the form to do that is on the slides.
Okay. We are a level E, so can we continue to compassionate care visits, hospice, and end of life?
Yes, and this is per CMS guidance. Compassionate care visits are allowed, but they're the only kind of visits, according to CMS, that are allowed when you hit, level E, or did they say red?
Level E.
If you're level E, visitation requirements are not dependent on level E at all anymore. So you can do general visitation along with end of life ADL. So you're pretty much open to visitation as long as you're not in a red category as well. So if you're on the CMS red category, then you are limited to compassionate care. But if via state guidance, you're level E, that should no longer matter in terms of visitation. Testing, yes. Visitation, no.
Okay. If you have been fully vaccinated, if you have been a fully vaccinated healthcare worker and a family member is positive, do you quarantine for 14 days?
I would refer you to the CDC guidance that talks about the level of exposures. I don't think at this point the vaccination status is included in that, because persons who are vaccinated may not get sick, but they can still actually carry the disease and transmit the disease, according to the thinking right now. So the vaccination status won't matter. What will matter about whether or not you have to quarantine is the level of your exposure, and there is CDC guidance for that.
Are we able to allow dogs into our SNF homes yet?
That has come up before, and there is really no clear guidance about it. The state first heard a question about that last week, and they didn't know how to respond. The CDC talks about pets in some degree, but they really don't talk about therapy pets. Definitely not a good idea. And I think that some facilities have allowed individual pets in with some precautions. There's nothing out there that says you cannot do it. I would think that you would just need to look at the situation and apply some routine safety rules.
How does being vaccinated impact this for residents?
How does being vaccinated impact?
It just says impact this, so I'm not really sure. It must have been whatever you were talking about at that point.
So let me just say this about vaccination. So far, it hasn't changed anything in long-term care facilities. We anticipate that the CMS may update their visitation guidance shortly. We're never sure about what the state's going to do in response. We'll have to see that. But they are at least saying that they're going to look at some of the more restrictive problems that we've talked about throughout today and before. But at this point, vaccination does not impact any of the rules in nursing facilities in terms of testing, visitation, etc.
Do non-visitors such as construction workers or utility workers need to be tested or just screened?
My understanding is that they have to be tested as well as staff. Originally, the state, well, I'm not sure at first, but at some point they had this weekly rule, this 8-hour rule. They have eliminated all those rules. And right now, the guidance states that anyone who enters your facility as a service provider, either medical or non-medical, have to be tested at the same requirements that your staff do. So if you have someone coming in your facility that is only coming in once or twice, you still have to test them.
MDHHS said on the call last week we could still use expired boxes of the Abbott tests, and they were going to put that in writing for us. There was a formula for expiration date versus manufacture date. We have not seen that document yet.
Yes, that's true, and we have not seen that document yet either. There were some requirements around it, but basically they're allowing use in general with some caveats for about 6 months beyond the date for some of these tests. So we're hoping to see that guidance as well, because it seems rather complicated to hear it. Hopefully it'll be coming out soon.
Okay. So with that looks like that would be our last question for today's webinar. So if you do think of anything after the webinar has concluded, you can always email Safe and Calm, Dalton, David, or Deanna at leadingagemi.org, and we will make sure to get that question and answer to whoever it needs to go to. So with that, we would like to thank Dalton, Deanna, and Dave all for joining us and the great information today, as always. And we would also like to thank the 90 members and participants that took time out of their busy schedules to join us for today's webinar. We appreciate everything you guys do each and every day to support your staff and provide quality care to your residents. We are grateful for your continued support, and we are here for you when you need our assistance and resources. So with that, I hope everyone has a great remainder of their Wednesday, and we will see you next Wednesday, March 17th, at the same time as always. Thank you and have a great day.
Thank you, everyone.